DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Folks, welcome to DocTalk. I'm Dr. Dan Thomson here. We're going to have a great show today. We got Dr. Dave Rethorst from Beef Health Solutions, which is a local veterinary clinic that also does some consulting nationally on preventative health. We're going to talk about calf scours, prevention, and treatment.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Dr. Rethorst, welcome to the show.
As always, good to be here, Dan.
Folks, this is my good friend, Dr. Dave Rethorst, who is a veterinarian and is the owner and operator of Beef Health Solutions. And Dr. Dave, just kind of talk to me a little bit about what your company's doing and the services that you're providing.
Well, Dan, we're providing traditional veterinary services to an extent in the Manhattan area and some outlying areas, but as you well know, my mantra is prevention.
Yep.
And what we can do to prevent things. One of my favorite slogans recently is because nutrition matters.
Yeah.
And the health of our calves starts when we turn that bull out. It starts at conception.
Yep.
And what we do during pregnancy impacts the lifetime health and performance of that calf. And we don't need to be using more vaccines and more antibiotics as a crutch. We need to figure out where we're messing up in management. And so that's what I'm trying to do is, I'm providing traditional services and, testing bulls and preg checking cows, but I want to get back to, what are we doing to prevent things? Let's cut down on our antibiotic use. Let's improve our animal welfare.
You bet. Well, you've always done a great job with it. Your leadership within the veterinary profession and the care that you provide clients, it's going to be fun to walk with you and grow this company and watch where it goes, because folks, it's going to go big places. We're going to talk about calf scours, which you kind of led us right into this.
Absolutely.
And just talk a little bit about some of the things that when you're in general, we have different types of bugs that cause calf scours, right?
Right. We've got bacteria, we've got viruses,
parasites,
all sorts of things cause calf scours. But usually that's an indication we've got something wrong in the management system. If we dig deep enough, we'll find something wrong. But, we've got E. coli, and, E. coli can show up in a 24-hour-old calf, and extend on for a couple weeks. Our viruses, Rota and coronavirus, don't show up till 7 to 10 to 14 days of age and are protracted just because destroys the epithelium of the gut enough they can't resorb fluids. We've got salmonella that's becoming a big thing. So we've got all kinds of bugs out there, but it's an indication of something else going on.
And when you're looking at that calf that's got scours, what are some of the things that you use to kind of grade the clinical signs on the severity?
Depression, you know, if they're really depressed, dehydration, if that eye sunk back in their head, just attitude, have they nursed, is mama's bag full, and things like that.
So not only the diarrhea, but depression, anorexia, weakness, just general malaise and things like that. And if we do that, then we got to get them in. Folks, one of the things we're going to talk about here with Dr. Dave is he talks about prevention and moving forward. We're going to talk about some diagnostics next. Thanks for watching DocTalk.
This Prevention Works Minute, brought to you by Beringer Ingelheim Vet Medica, Inc.
Hey folks, welcome to our Prevention Works Minute. This is an outstanding segment, and I'm really glad that we're getting to do this when we talk about preventative medicine for cattle. Biosecurity is important, and a good key component to that is vaccination. When we vaccinate an animal, one thing you need to understand is that they do not work immediately. Matter of fact, it takes 7 to 14 days before the animal, once it's vaccinated, to actually start having an immune response that produces antibodies that are specific for a disease in which we would vaccinate them for. So if I vaccinate a calf for IBR, it's 7 to 14 days before that animal is protected or has antibody to neutralize IBR virus. Once we get out there to 14 to 21 days, the body has memory cells for IBR. That's why we give them a booster, and we get that booster in our titer response. Vaccines don't work immediately, but they're really good for prevention.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dave Rethorst, and we're friends and colleagues and veterinarians, and Dr. Dave now has a company providing traditional veterinary services along with some of the preventative medicine services for cow herds locally and cow herds around the country. Beef Health Solutions is the name of that. And Dr. Dave, talk to me about, okay, so when we get into a wreck with E. coli, Salmonella, Rota, Corona, what are some things that you're going to do as a veterinarian as far as diagnostics to what kind of samples are we going to send in, and what kind of tests are we going to ask for?
Okay, first of all, on diagnostics, I want to get a good history of the herd. I want to see what the herd looks like, what the environment looks like, and then we're going to, you know, obviously if we've got dead calves, we're going to get good specimens, get them into the diagnostic lab, get some culture work done.
Send the whole calf?
If you're close to the diagnostic lab, you know, a whole calf works well. If you're not, you know, learn how to do a good job at taking samples. You know, good fresh samples, isolated gut loops, swabs, fixed tissues, lymph nodes.
And see, for me, okay, so if I'm a cow-calf practitioner and I got scours going on, I have no problem just loading up myself and taking that calf to the dealer. I mean, a half-day drive or whatever is nothing compared to the way I care for those calves. So
and it's You know, as our friend Dr. Spare just said, we're affecting the livelihood of those producers, and we have to show them that we care. So if it takes hauling a calf to the D lab, do it.
Yeah, get it in there. So you know, one of the things that you mentioned was, you know, history and premise inspection. And folks, we can't diagnose these things over the phone or over the email. As a veterinarian, you have to get on the ground, right?
Boots on the ground absolutely is essential on getting on top of these problems.
And so when you're having that scours problem, getting your veterinarian out to the farm sooner rather than later to be someone that can give you a second set of eyes, timing is probably, as fast as neonates can succumb to these diseases, timing is of the essence. And so staying on top of it, working on preventative measures, but getting someone there soon rather than later is important.
Absolutely.
Dr. Dave, let's talk about some of the different samples that you might, after you get your samples collected, what are some things that diagnostic labs are going to do?
Okay, they can, you know, probably the most common is what we call a culture and sensitivity for bacterial scours. You know, find out what bug's there, do a sensitivity on it, find out what antibiotic it's sensitive to, and hopefully it's one that's labeled for beef cattle.
Right. Yeah, that's important too.
Always helps. You know, with fresh fecal samples, they can do virology studies, and you know, and see, do we have rotavirus there? Do we have coronavirus there? You know, BVD, yep. All sorts of samples we can.
And a lot of times what we find is, like you said, is secondary to the immunosuppression.
Right, and it's the immunosuppression, the mismanagement, or something not quite right in management is the underlying cause of our scours.
Cool. When we come back, we're going to talk about how we treat calves with calf scours with Dr. Dave Rethorst and Beef Health Solutions.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Clostrix. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Colostrix colostrum supplements. Colostrix is USDA licensed and proven effective. When your money is on the line, trust Colostrix.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dave Rethorst, who's a veterinarian and owner and operator of Beef Health Solutions, which provides traditional veterinary bovine care along with preventative medicine consultation for you and your herd. Dr. Dave, we get a calf, we've got calf scours, we've got the diagnostics, we have an understanding now of what's going to help this calf heal itself. What are some things that you implore or employ when we treat these calves?
First and foremost, Dan, is we've got to get these calves rehydrated. It's the dehydration that kills 95% of the calves. It isn't the bug. It's, you know, like on Rota and Corona, virus scours. You know, it's the fact that those viruses destroy all the thousands and millions of little fingers of absorptive surface in that gut. They can't absorb fluids, so we've got to stay after them diligently with fluids, get them rehydrated, and use antibiotics more or less as a secondary thing. I'm a big fan of oral fluids. If we catch these calves early, get oral fluids in them, do it 2 or 3 times a day, use the proper fluids. We don't need to use the IV fluids, but if they get really down and depressed, then we have to use IV fluids on them.
Okay, so talk to me about oral fluids. What are some things that, if you go into the Orslins or go into a veterinary clinic, pick up one of these electrolyte fluid mixes for the calves?
Yeah, some of those are, I won't say some of them are poor, but there's some that are better than others.
Okay.
One of my old favorites, and I hate to mention.
No, you can mention.
Rethorst is a really good one. Some of the others have, in my opinion, too much dextrose in them and will actually prolong the scours because that extra dextrose is pulling fluids into the gut. There's one I've been using the last couple of years, and I'm blank on the name of it right now, but it's kind of an orange-colored fluid when you mix it up, and it's really a well-balanced fluid and does a really nice job on these calves.
So when we think about fluids, and again, the oral fluids, you say 2 to 3 times a day, and probably going to use a calf feeder to
Yes.
get it down.
Yep.
Get it down, make sure that they get it. How much are you recommending that we give?
I like to use 2 quarts 2 to 3 times a day.
Okay. And remember, folks, if you want to know how dehydrated that calf is, just a simple skin tent. You pull that skin back, it should snap back into place. If you pull the skin on that calf and it stays and then slowly goes back, that calf's dehydrated and needs fluid help.
Needs some fluids. And if many times a depression, in and of itself is an indication of fluids. We've got some endotoxic shock going on. And
so the big thing on treatment, get them in a dry, warm place, get them on fluids, and then if there is a bacterial infection, an antibiotic that is effective, whether it's in a bolus or in an injection, utilize that. That's pretty much our, and then we're looking for endotoxemia as well.
Right, and I like to use the injectables. I don't like to use oral antibiotics because I want to take care of the systemic infection, but I don't want to mess up the flora in that gut any more than it already is. So
some of these bacterial infections can go away outside the gut, and so we have to treat the endotoxemia. So water soluble antibiotic that. But be sure to work with your local veterinarian. He knows the bugs, he knows the drugs, he knows your geography. When we come back, we're going to talk with Dr. Dave about one of his passions, preventing calf scours.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We are Mike and
Martha
Armitage here at the A-Bar Ranch, Claremore, Oklahoma. We have a cow-calf production company, and we also have a marketing company. We have entertained groups brought to us by the Beef Checkoff, such as South Korean media that covered our operation and brought the good news back to South Korea.
That was a really neat experience, and that we got to have young people from another country that we got to experience a lot of different things in their culture, but got to share our culture too.
We live on the Squaw Creek Ranch. Here is a division of the A-Bar Ranch.
As a wife and a mother, and also with my background in more of a health field, I look at just the nutritional value, and it's great that the Beef Checkoff offers that kind of information to the consumers that are out there.
We both are proud to come from agricultural, more specifically ranching backgrounds.
My dad is a part of the Beef Checkoff board, and so the Beef Checkoff has been something that we promote and that we support what it has to offer.
Not everybody who's in agriculture is tech savvy on Facebook and through social media. Most people in the city happen to be, and they are very disconnected from our day-to-day routines. And that's one thing that makes me proud of the Beef Checkoff, them going to bat for us, from those who aren't necessarily anti-ag, but just simply don't know and they aren't getting the information.
As producers, we're strong supporters of that and hope that many of you out there realize all of the different things that the Beef Checkoff brings to the table for us as producers.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. This is Dr. Dan Thomson here with my friend and colleague, Dr. Dave Rethorst, who's a veterinarian and owner of Beef Health Solutions, which is a company that provides traditional veterinary health care for your herds and also provides preventative medicine consultation, animal welfare consultation, food safety, many different things that will help you and your herd put yourself in a position to be ahead of the curve. Dr. Dave, when we talk about preventing calf scours, kind of talk me through, if I was a producer sitting there and you're saying, hey, let's talk about calf scour prevention. You know, obviously, vaccinate, you know, it starts with that cow.
It starts with the cow, and I'll start with vaccine and then I'll digress a moment.
Okay.
You know, traditionally when we think about preventing, we jump to a vaccine, and there's several good vaccines out there, you know, take care of the E. coli, the rota and coronavirus. Sometimes we throw in a clostridial for the enterotoxemia. There's places that we have to use a salmonella vaccine. But all that aside, that prevention starts when that cow is pregnant, as I said earlier, because nutrition matters. You know, how we feed that cow, our nutrition program, protein, energy, trace mineral during pregnancy, affect that calf's immune system. The amount of protein in that cow's diet affects that calf's ability to absorb colostrum. It all starts there, and if we've got a ongoing scours problem year after year after year, you know, we need to go back and look at the whole program, not just throw a vaccine at it because, well, we got a rotavirus last year, we need to add a rota. Well, yeah, we probably need to add a rota, but we need to look at what else we can do.
Yep, and so when we look at nutrition and vaccination of the cow, we're also looking at the development of the immune system of the calf in utero, and then the immune system of that calf due to the proper colostrum intake. And so cow nutrition, colostrum. What about after the calf is born? What are some things we can do to set that calf up for success?
Well, first of all, ensure colostrum intake. You know, a study up at Meat Animal Research Center a number of years ago, calves that do not get adequate colostrum are like 3.5 times more likely to get sick as babies and 6 times more likely to get sick before weaning. So work on that colostrum. Then we can look at things like the Sandhills calving system, where, you know, after 10 days of calving in a pasture, we move the pregnant cows out, we leave the pairs in that pasture. That way those pregnant cows are calving on clean ground. We cut down on the environmental contamination of those calves when they're born. Another one of my pet peeves is biosecurity. You know, we lose a calf off of a first calf heifer or a second calf heifer, and we run to the neighbors, or we run to the dairy, or we run to the sale barn, and we buy a calf to put on these cows because we don't want them to run dry. You know, all you have to do is go through one wreck where you see somebody bring in a salmonella with a calf that they bought so that heifer didn't run dry, and you'll let an awful lot of heifers run dry rather than bring in salmonella or some foreign E. coli or a BVD.
Wow. Great information, folks. Great man here, great veterinarian. Be sure to work with your local veterinarian, and if you want to know more about what we do here at DocTalk, you can find us on the web at www.doctalktv.com. Dr. Dave Rethorst with Beef Health Solutions. I'm Dr. Dan Thomson. Thanks for watching DocTalk, and I'll see you down the road.
Closed captioning brought to you by AgriLabs, the perfect pairing of performance and value. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.